Have you ever considered how prevalent strokes are and the impact they have on our lives? Strokes are a significant health concern worldwide, affecting millions of people each year. They can lead to severe disability and are a leading cause of death. The pervasiveness of stroke is not confined to any specific age, gender, or race. It can happen to anyone, anywhere, at any time. Recognizing the signs of a stroke and responding quickly is critical, as early diagnosis and treatment can significantly increase the chances of survival and recovery. Moreover, understanding and managing risk factors can go a long way towards prevention. This involves adopting a healthier lifestyle, managing chronic conditions, and regular checkups. So as we delve deeper into the world of strokes, remember, knowledge is power. Strokes can happen to anyone at any time. But how do we know when it's happening? Recognizing a stroke early is crucial. So how do doctors diagnose a stroke? The first line of defense in diagnosing a stroke is gathering a detailed medical history. Doctors need to understand your past health conditions and any risk factors you might have. This information is crucial in determining whether you're experiencing a stroke and what type it could be. Next up, a physical examination is conducted. Here, doctors assess your motor function, coordination, reflexes, and cognitive abilities. They are looking for any signs of weakness or disruption that might indicate a stroke has occurred. If a stroke is suspected, doctors then turn to diagnostic tests. One of the first tests usually administered is a neurological examination. This is a more in-depth evaluation of your brain's functionality and can help pinpoint the area of the brain affected by the stroke. Imaging tests like CT scans and MRI scans are also vital in the diagnosis process. These tests can provide detailed images of the brain, showing any abnormalities in structure or blood flow. They can help doctors determine if a stroke has occurred, its location, and its severity. Blood tests are another useful tool. They can reveal underlying conditions that may have led to the stroke, such as high cholesterol levels or clotting disorders. Doctors can also use them to rule out other conditions that may cause similar symptoms. Then there's the electrocardiogram, or EKG. This test records the electrical activity of your heart. It's used to identify irregular heart rhythms, which could increase your risk of stroke. These diagnostic tools are all part of a comprehensive approach to diagnosing a stroke. The information they provide is crucial in determining the best course of treatment. Remember, time is of the essence when dealing with a stroke. The sooner a diagnosis is made, the quicker treatment can begin, and the better the chances of recovery. A correct diagnosis is just the first step. The treatment that follows is vital for recovery. So, stay tuned as we delve deeper into the different treatments available for stroke in our next segment. Once diagnosed, time becomes the most valuable asset. So how do doctors treat a stroke? Well, the treatment of a stroke largely depends on its type and severity, and the speed at which medical attention is given. Let's break it down. Ischemic strokes, which occur when a blood clot blocks an artery, are treated with thrombolytic therapy. This involves the intravenous administration of clot-dissolving medications, like tissue plasminogen activator, or TPA. When given within the first few hours of symptom onset, these medications can dissolve the clot and restore blood flow to the brain. In cases of a large vessel occlusion, a more hands-on approach may be required. This is where a procedure called mechanical thrombectomy comes in. It's a type of endovascular procedure where doctors physically remove the clot from the blocked artery. To prevent further clot formation, doctors may prescribe antiplatelet medications like aspirin. But remember, these treatments are most effective when administered quickly after the onset of symptoms. On the other hand, hemorrhagic strokes, which occur when a blood vessel in the brain ruptures, require a different approach. Here, the focus is on controlling the bleeding, reducing pressure in the brain, and stabilizing vital signs. Surgical interventions may be necessary to repair the ruptured blood vessels or remove blood clots. Then there's the treatment of transient ischemic attacks, or TIAs, often referred to as mini-strokes. These are temporary blockages of blood flow to the brain and are often a warning sign of a major stroke. Treatment of TIAs involves identifying and addressing underlying risk factors to reduce the risk of a full-blown stroke. In all cases, immediate treatment is crucial. Every second counts when it comes to stroke treatment. The sooner the treatment is administered, the better the chances of limiting damage to the brain and achieving a positive outcome. But treatment doesn't stop at the hospital. Post-stroke care is equally important. This can involve physical therapy, occupational therapy, speech therapy, and other rehabilitation techniques to help regain lost skills and relearn tasks. It's also important to remember the role of medication in stroke recovery and prevention. Doctors may prescribe medications to control blood pressure, cholesterol levels, and other conditions that could increase the risk of another stroke. And lastly, emotional and psychological support plays a crucial role in recovery. Stroke can be a traumatic event, leading to emotional distress and depression. Counseling and support groups can provide comfort and help individuals cope with the emotional aspects of stroke recovery. So, that's a quick overview of how strokes are treated. It's a complex process that requires immediate medical attention, careful management, and ongoing support. But remember, successful treatment can significantly improve outcomes. But wouldn't it be better if we could prevent strokes in the first place? Indeed, prevention is better than cure. So how can we prevent strokes? Just as we've explored the prevalence, diagnosis, and treatment of strokes, it's equally important to focus on how we can preempt this perilous event. Firstly, controlling high blood pressure is paramount. Regular monitoring and management of hypertension can greatly reduce the chances of a stroke occurring. This might involve lifestyle changes or medication, but the key is to keep a close eye on it. Next, let's talk about smoking. Tobacco use significantly increases the risk of stroke and other cardiovascular diseases. So, quitting smoking is not just a good idea, it's a life-saving one. There are many resources and support systems available to help quit smoking. It's never too late to start. Managing diabetes is another crucial preventive measure. Maintaining blood sugar levels within a healthy range can decrease the risk of stroke. This involves a combination of diet, exercise, medication, and regular checkups. Speaking of diet, maintaining a healthy one is of utmost importance. A diet rich in fruits, vegetables, whole grains, and lean proteins can help prevent stroke by promoting heart health and controlling weight. It's about making smart food choices that nourish the body and the brain. Engaging in regular exercise goes hand in hand with a healthy diet. Physical activity can lower blood pressure, improve cholesterol levels, and reduce the risk of obesity and diabetes. It doesn't have to be a strenuous workout regimen. Even a brisk walk a few times a week can make a significant difference. Alcohol consumption needs to be addressed too. Limiting alcohol intake can help prevent stroke and other cardiovascular diseases. Moderate drinking, or better yet, abstaining from alcohol, can greatly reduce the risk. Managing cholesterol levels is also key. Lowering LDL, the so-called bad cholesterol, and raising HDL, the good cholesterol, can reduce the risk of stroke. This can be achieved through diet, physical activity, and medication if necessary. Lastly, let's not underestimate the power of stress management. Chronic stress can contribute to high blood pressure and other risk factors for stroke. Techniques such as meditation, yoga, and deep breathing exercises can be effective in reducing stress levels. In conclusion, prevention of stroke is a multifaceted approach that involves lifestyle modifications and regular health checkups. It's about making small, consistent changes that add up to a significant impact on our overall health. With these preventive measures, we can significantly reduce the risk of stroke and lead healthier lives. Stroke is a serious medical emergency that requires immediate attention and intervention. It is diagnosed through a blend of medical history, physical examination, and diagnostic tests, such as neurological examinations, imaging tests, blood tests, and electrocardiograms. Treatment hinges on the type and severity of the stroke. For ischemic strokes, options include thrombolytic therapy, mechanical thrombectomy, and antiplatelet medications. Hemorrhagic strokes require controlling bleeding, reducing pressure in the brain, and stabilizing vital signs, sometimes through surgical intervention. Transient ischemic attacks, or TIAs, are treated by identifying and addressing underlying risk factors. Prevention of stroke is crucial and involves controlling high blood pressure, quitting smoking, managing diabetes, maintaining a healthy diet, engaging in regular exercise, limiting alcohol consumption, managing cholesterol levels, and managing stress. Recognizing the signs of stroke, seeking prompt medical attention, and addressing modifiable risk factors can significantly reduce the risk of experiencing a stroke. By understanding strokes, we empower ourselves to minimize its impact, improve outcomes, and lead healthier lives.